My dad works in B2B marketing, but I never really knew what that meant. Then one day my dad came by my school for career day and told everyone in my class he was a big MQL man. Then he just kept saying things like, the more MQLs, the better, over and over. My friends still laugh at me to this day. I think it means marketing qualified lead. One thing's for sure, I'll be known as the MQL man's kid for the rest of my days. Why couldn't you just be a fireman or a lawyer? Why? You ruined my life, Dad.
Not everyone gets B2B, but LinkedIn has the people who do. And with ads on LinkedIn, you'll be able to reach people based on job title, industry, likelihood to buy, and more. Start converting your B2B audience into high-quality leads today. We'll even give you a $100 credit on your next ad campaign. Go to linkedin.com/customer to claim your credit. That's linkedin.com/customer. Terms and conditions apply. LinkedIn, the place to be, to be.
This is Tanya Rad from Scrubbing In with Becca Tilley and Tanya Rad. This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all black everything phase, list it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay. The place to buy and sell new, pre-loved, vintage, and rare fashion. eBay. Things people love.
Are lingering depression symptoms affecting you? If you're on an antidepressant and still struggling with lingering depression symptoms, ask your doctor about a lift in relief with Vraylar, cariprazine. Vraylar is a prescription medicine approved for use with antidepressant medicines to treat major depressive disorder, MDD, in adults. Adding Vraylar to an antidepressant is clinically proven to help relieve overall depression symptoms better than an antidepressant alone. Results may vary. Vraylar is not approved in elderly patients with dementia-related psychosis or for people under 18. Elderly dementia patients have increased risk of death or stroke. Report unusual changes in behavior or suicidal thoughts. Antidepressants can increase these in children and young adults. Report fever, stiff muscles, or confusion, as these may be life-threatening, or uncontrolled muscle movements which may be permanent. High blood sugar, which can lead to coma or death, weight gain, and high cholesterol may occur. Difficulty moving, tremors, slow or uncontrolled body movements, restlessness, feeling like you need to move around, nausea, constipation, insomnia, dizziness, increased appetite, and fatigue are common side effects. Side effects may not appear for several weeks. For a lift and relief, ask about adding Vraylar, Vraylar. Visit Vraylar.com or call 1-877-6-VRAYLAR to learn more.
Odoo is business management made so simple, a kid could explain it.
Sometimes business software can't talk to other programs. But Odoo, funny word, has every program from CRM to HR to accounting in one platform. It should cost a lot, but it doesn't. So you should use Odoo because they save you money.
Odoo makes a lot of sense, but doesn't cost a lot of sense. Sign up now at odoo.com.
That's ODOO.com.
Good job.
Thanks.
1 in 3 women and 1 in 4 men experience domestic abuse in their lifetime. And nearly half of survivors delay leaving because they can't bring their pets with them. Purina started the Purple Leash Project to help eliminate one of the many barriers domestic abuse survivors face, a lack of pet-friendly domestic violence shelters. Through the Purple Leash Project, Purina is helping to create more pet-friendly domestic violence shelters across the country, so abuse survivors and their pets can escape and heal together. Visit Purina.com/purple to get involved.
Hi, everyone. I'm Rachel Zoe, and you're listening to Climbing in Heels for your weekly dose of glamour, inspiration, and, of course, fun. There really is just not enough I can possibly say about the intelligence and grit of my guest today. I've never experienced any conversation like this one. Dr. Macrene is a world-renowned dermatologist, cosmetic and reconstructive surgeon, and skincare innovator, just to name a mere few of her titles and accomplishments. Yes, MD and PhD. Her commitment and passion for science and medicine has made her an absolute pioneer in her very male-dominated field. Her skincare line, Macrene Actives, is truly changing the game, and her mission to rid not only her industry, but the world of toxins and plastics is so beyond inspiring. Let's dive right in with the one and only Dr. Macrene.
So first of all, I'm so excited to have you on. I wish I was sitting next to you, but that's the beauty of Zoom. I've been doing this podcast for a while now, and I've had some pretty extraordinary women. And I have to say, I've had women on here that have not graduated high school. I have some that have graduated college. I have a few that have done more than all of that. You are the most highly educated person I think I might ever have met in my possible life. And you've also received more awards for your profession and beyond, but like Harvard, clinical professor at Yale, da, 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 da. It's literally 2 full pages of just what you've done. You're speaking to someone now who chose not to become a psychiatrist because I had to go to extra school after I graduated college. So I'm so excited to have you on.
Well, first of all, Rachel, I'm so happy and excited to be here. I loved you the minute I met you at Gwyneth's dinner, at Gwyneth Paltrow's house. And it's like we instantly bonded, and I feel a sisterhood with you. And since then, our relationship has only grown. And I'm just so excited to be on your podcast. And I'm so proud and happy to
Likewise.
I've connected with you, and you're doing such good in the world and bringing this communication to everyone out there. Thank you for honoring my life story. I was very precocious, started in science at an extremely young age. When they honored me at Harvard with the Fay Prize, which is the highest undergraduate honor, they told a story about how I was.
I'm only laughing because I'm like, these are things people like joke about. Like this person's going to get this honor, but you actually.
I mean, it's nuts. I mean, it's never enough. And you know, in this podcast, it'll probably come out that, you know, I so related to Hamilton, where he was never satisfied. You know, anybody who saw Hamilton on Broadway, that's like me. I have an unsatiable appetite for life. And when I was 3 years old, I was like following ants in the garden and putting little sticks to follow their path. I was before I went to preschool. So my parents think I was around 3. And it turns out that when I sat in my Harvard biology class, like all those years later, they had just discovered that there were these invisible scents that ants had left for the path between the crumb and the anthill. So I was like a scientific mind from a very young age, and went into lab at 12 after reading Rachel Carlson's Silent Spring, and was hell-bent on replacing toxic pesticides with plant-based alternatives. And that's what got me my start in science and university lab. And then I skipped 2 years and went to Harvard at 16 after winning Westinghouse. And once I got to Harvard, I worked first in insect biology, then plant molecular biology. And that's why when I ultimately, and then I got a Fulbright. And then when I ultimately did the MD PhD and became a dermatologist, I immediately applied that entire predecessor life of like plant molecular biology to replacing toxins in skincare. Hence, Clean Beauty was born. I was the first to formulate clean at a very early juncture, replacing toxins with clean formulation. And I've since gone beyond that and am working on clean packaging and manufacturing practices, all because of my love of the earth and my love of science.
That is so extraordinary. It's extraordinary that you remember all of it. It's extraordinary that you've done all of it. But I want to talk about, because Climbing in Heels is really about digging into the journey. And I want to really understand, because it's clear, obviously, your obsession with science, right? And ultimately what led you to dermatology. But it's interesting because I always wonder, as a female in such a male-dominated industry, certainly at the time that you were coming up,
Yes.
I imagine it was mostly men.
Yes.
At what point were you like, I'm obsessed with this, and this is because when I meet like med students and science students, it's always like, what lane are you going to choose? Because there's thousands, right? What made you say dermatology versus like neurosurgeon or what, you know, that's
right. How interesting that you bring that up, because it's, you know, one of the reasons I ended up in dermatology was because I was given kind of I will call it a choice at a critical juncture in my career. because I was actually very interested in neurosurgery as well as plastic surgery. I was an artist from a young age. The other thing besides following ants is I was really good at portraits. So I started doing portraits when I was really little, and my parents used to have parties in their home, and the guests used to line up for me to do their portraits. So
Really?
I was struggling as to whether I was going to become an artist or a scientist for many, many years. But my mother didn't want me to be a starving artist. So I went into the sciences, and it was a man's world and still is a man's world because these institutions were built by men.
Right.
And so I've been famously quoted as saying, to puncture the glass ceiling, you have to build your own house. So that's what I've done, because I've noticed that even within the departments, one could be the most highly published, highly cited author in their department for 20 years running, and still they will block advancement. They will find a loophole. And that is an issue to this day.
Do you mean because you're a woman?
I believe that that plays a huge role, because I've noticed that in many of these instances, men keep receiving awards that are purely discretionary. They still hold the dominant number of positions of power in our organizations.
And in the world.
Yes, and they hold on to those reins, and it's very hard to get through. So that's why I built my own practice, my own little microcosm, if you will, not just the clinical practice of dermatology in my institute in New York, the Hamptons, and in Europe, because I'm, as far as I know, the only dual certified in medicine, surgery, and dermatology in the European as well as the United States. And working on even furthering that certification to be global, but also within the skincare brand that I've established, which is Dr. Macrene Actives.
Which I am obsessed with.
Thank you. And
God, does it work?
Says you got to get behind the brand, because
God, it really works.
And it really works.
You said that to me this summer. You said, okay, I need you to try this, because all your treatments are going to last longer. You're going to need this less, like da-da-da-da-da. And honestly, I don't think I've really even touched my face since I've seen you, so I mean, it's really effective. And I want to talk about that after as well.
Thank you for saying that, by the way, because the only way our world is going to be saved from toxins, plastics, is if you actually put your dollars as a proxy for your vote for your future. Right. And so if you put your dollars to Dr. Macrene Actives, you're putting your dollars towards clean formulation with plant-based ingredients that replace toxins, that are highly effective to replace procedures, and clean packaging, which my goal is to eliminate plastics for the industry, and clean manufacturing practices. And it does yourself a favor, because it frees you of the shackles of having to do either plastic surgery or injectables or lasers, because that's my area of specialty, and I've translated that into actives. But you're right. I was very interested in neurosurgery. I was very interested in plastic surgery. But after doing everything I had done, a Fulbright, an MD, and a PhD in genetics at Harvard, 3 Harvard degrees, I fell in love. I was engaged to be married. And I was putting in my applications for residency, and I was told, well, either you're going to be a surgeon or you're going to have a family. And I was like, oh my God. Yes. And that's what happened to me. And I'm not saying I'm one. I think it's true for a lot of women, and it may be conversations that are had at the dinner table. They're valid conversations because, and I'll tell you why. They're valid conversations because the most precious commodity we have is our time. And neurosurgery is grueling. It was going to be 8 years of training on top of what I had done. Every other night of call. This was before the Bell Commission, guys. I only got 5 weeks of maternity leave when I was a resident. I had to take all my call before I delivered. It was brutal. And then my first job as a dermatologist, it was unpaid leave. And I was expected to take call during my unpaid leave on any of my patients for follow-up and to be available. So it was a grueling time in history where women were not treated with respect when they were delivering. So it was hard enough as it was. And frankly, choosing dermatology I was giving it up. My mentor at Harvard Medical School, Robert Godwin, who was he was like the godfather of plastic surgery. He was the editor-in-chief of the Annals of Plastic Surgery for 20 some odd years, the chairman of the department at the Brigham. I was his prodigy. He had me closing his cases as a medical student. I was sewing his cases shut. I didn't realize until like I got much older how rare and unusual that is.
Right.
Medical students usually don't touch the patient. They just watch.
Right.
I was actually sewing. We were comparing my breast to his, and he was like, wow.
So now I have a question. With the plastic surgery that you were doing, because there's a question I have. There's cosmetic plastic surgery, and then there's like trauma, right? There's, I don't know what you call it in the medical.
Good point. So plastics, yeah, it's plastics and reconstructive surgery. And that does encompass repairing wounds due to trauma,
right?
Birth defects,
right?
Major issues all over the body.
Right.
And then there's sort of the aesthetic plastics, which is sort of facelifting, neck lifting, tummy tucks, etc.
Right. Okay.
And a lot of people, it's obviously more financially viable to be doing plastic surgery that's in the aesthetic sphere than to be on call in the emergency room when somebody splits their face.
By the way, because that makes sense, right? Like, what is the irony, right? Like,
right. But in my case, it was just because I was artistically gifted, and my brothers are surgeons. We're just very good surgically in my family. And he was very upset when I made that decision because he said to me in his office, Macrene, you're a thoroughbred. You need to run. You're a stallion. You need to run. I don't want you in the corral. And he understood my reasons. He accepted it. We stayed friends until the end of his life. But what I did once I got into dermatology was I'm one of the pioneers in my field. I started in lasers and devices in 2000, and I've been involved in the device development of every class of technology that's been born in the last quarter century, as well as pharmaceutical trials for things like Botox, fillers. I was the lead author and lead investigator on the most recent advance in fillers, the first new filler in dozens of years. A lead investigator and lead author on the first FDA-approved laser for acne, the Abiclear and the JAD. I have done such groundbreaking work in my industry.
I was going to say, okay. Well,
so
I want to talk about that.
You get lemons, you make lemonade. So like life is fractal. So we as women may be told we can't go through this door because X, Y, and Z. So we go in through another door. And guess what? When you walk through a new door, life is fractal. A myriad of new opportunities emerge.
Of course.
So within that door of dermatology, I was able to apply all of my skills. So I don't look back and regret. I look forward with opportunity.
Right. Well, also, I think a long time ago, if you said dermatology or skin, that was like, oh, it's a vanity thing. I don't even look at it like that anymore. Like, I actually don't. Like, yes, of course, there's that element. We all want to look 20 years younger than we are. Sure. Not all, but most. And we can, thanks to you. And, I think at the end of the day, it's like when people used to say to me, but clothes are just, it's like an exterior thing. It's like superficial. It's like, it also really informs how we feel, right? And really can hide things that we may want to hide on any given day, and also lift us out of something that might feel rather dark. What you're doing is a very high stakes job. When I think about it, it's funny because I always said, like, I don't even know if I'd want to be a hair colorist, because if I messed up someone's hair color, when you're dealing with someone's face, I mean, it's the thing that typically matters most to people, right? Outside of their obvious health, right? Yeah. But how many children do you have?
2 children.
2. So I think when you were having your children, you were clearly building your career at the same time. And I think it's just the question I always have to ask, because I think everyone deals with it differently. But how were those years and those moments where did you ever have to turn down jobs? Did you ever have to, how did that work? Because doing what you do, despite the fact that it's not neurosurgery, you still have a very high demand of your time and urgency.
Yes. These are such amazing questions. Well, when I was looking for my first job, with my pedigree, I was groomed to be, because I'm a physician scientist, the chair of a department. Okay, that's really what I was being groomed to be. But to do that, you need to take what's called a tenure track position, or a position in academia that is by definition a full-time job. And I went around, I shocked myself I happen to know I was ranked number one in the country because Erwin Friedberg told me at NYU that I was ranked number one when I applied to dermatology. So that was like not a secret. So when it was time for me to look for a position, I knew where I ranked. Right. And yet not a single chairman I spoke to would allow me to work 4 days a week while I was having children and still qualify to get back on a tenure track for full professor when I got back. And I'm not talking about clinical because that's outside. I'm talking about full professor within the university. So basically I was iced out. That is the leaky pipeline, guys.
Sure.
Listening to Macrene.
It's like, even if they're like, there's women in the room, or of course we're meeting with tons of women.
The leaky pipeline is this. They will not allow you to continue towards career goals if you take time out while you're having children. And that is the leaky pipeline. So I was very offended when a former president of Harvard University tried to comment that the aptitude of females wasn't as good as males for the sciences. I'm obviously living proof that that is absolutely untrue. But it's the leak, and the evidence they use is, well, look at how many professors we have who are female versus male. Right. Guess what? Right. If you're not going to allow me to work in a university and on a tenure track position, because at 4 days a week, which is not asking for a huge sacrifice, how would I ever make it there? So that was the reason why I started private practice. I started my own practice and chose to be a clinical faculty on a voluntary position at Yale instead of being a full-time clinician within a university setting.
Interesting. Mm-hmm. And also, I would actually argue to say that anyone who is using their hands for a living should probably only be on call 4 days, because the last thing you want is an exhausted person with their hand, right? I mean, truthfully, and when I think about that, I think about so many doctors on call and surgeons, even in the ER and everything. Like, I do think about that a lot. If they're doing surgery, emergency surgery at 3 a.m. or 4 a.m., like there's got to be some, and especially if you're on call, right? Like, you could be coming from a dinner, you had whatever it is. It's like, I always think about that. And I think about this type of thing where, there's such precision involved. But I do think that starting your own, and I do know from that because I've worked for myself since I was 25, there are pros and cons along the way of that, because there is no one to cover for you. There is no one to call in sick to. And you do end up working 10x harder when you're working for yourself, right?
Yes.
My dad works in B2B marketing, but I never really knew what that meant. Then one day my dad came by my school for career day and told everyone in my class he was a big MQL man. Then he just kept saying things like, the more MQLs, the better, over and over. My friends still laugh at me to this day. I think it means marketing qualified lead. One thing's for sure, I'll be known as the MQL man's kid for the rest of my days. Why couldn't you just be a fireman or a lawyer? Why? You ruined my life, Dad.
Not everyone gets B2B, but LinkedIn has the people who do. And with ads on LinkedIn, you'll be able to reach people based on job title, industry, likelihood to buy, and more. Start converting your B2B audience into high-quality leads today. We'll even give you a $100 credit on your next ad campaign. Go to linkedin.com/customer to claim your credit. That's linkedin.com/customer. Terms and conditions apply. LinkedIn, the place to be, to be.
Whether you're starting or scaling your company's security program, demonstrating top-notch security practices and establishing trust is more important than ever. Vanta automates compliance for ISO 27001, SOC 2, GDPR, and more, saving you time and money while helping you build customer trust. Plus, you can streamline security reviews by automating questionnaires and demonstrating your security posture with a customer-facing trust center, all powered by Vanta AI. Over 8,000 global companies like Atlassian, Flow Health, and Quora use Vanta to manage risk and improve security in real time. our audience gets a special offer of $1,000 off Vanta at vanta.com/special. That's VANTA.com/special for $1,000 off.
M&A can get chaotic. Between due diligence, integration, and everything in between, it's easy to feel like you're drowning in the details. I'm Kisan Patel, host of M&A Science, the weekly podcast that cuts through the confusion. Every week, I sit down with M&A pros who faced it all, the challenges, curveballs, and lessons learned the hard way. No buzzwords, no theories, just real actionable advice from people in the trenches. From keeping deals on track to managing integrations without losing your sanity, each episode is straight up practical insight, what works, what doesn't, and how to simplify your own M&A process wherever you are in the deal cycle. Want to close the next deal with confidence? Tune in to M&A Science. No fluff, just real talk about what it takes to close deals. Listen on your favorite podcast app. Here's to the deal.
Have you made the switch to NYX? Millions of women have made the switch to the revolutionary period underwear from NYX. That's KNIX. Period panties from NYX are like no other, making them the #1 leak-proof underwear brand in North America. They're comfy, stylish, and absorbent, perfect for period protection from your lightest to your heaviest days. They look, feel, and machine wash just like regular underwear, but feature incognito protection that has you covered. You can shop sizes from extra small to 4XL. Choose from all kinds of colors, prints, and different styles, from bikinis to boy shorts, thongs to high-rise. You've got to try NYX. See why millions are ditching disposable, wasteful period products and have switched to NYX. Go to knix.com and get 15% off with promo code TRY15. That's knix.com, promo code TRY15 for 15% off life-changing period underwear. That's knix.com.
You hear more and more about identity theft in the news every day. Maybe that's because so much of your personal information is out of your control. Like your insurance provider that has your social security number and your favorite retailer that has your payment details. If they get breached, your information is vulnerable. Fortunately, there's LifeLock. LifeLock monitors hundreds of millions of data points every second for identity threats. If your identity is stolen, a LifeLock US-based restoration specialist will help solve identity theft issues on your behalf, guaranteed, or your money back. Plus, all LifeLock plans are backed by the $1 Million Protection Package, meaning LifeLock will reimburse you up to the limits of your plan if you lose money due to identity theft. You might not be able to control how others handle your personal information, but you can help protect it with LifeLock. Save up to 40% your first year at LifeLock.com/iHeart. That's 40% off your first year at LifeLock.com/iHeart. Terms apply.
I feel like I'm an Olympic athlete.
Yes, that's what I always say.
Because I demand the absolute best, 10 out of 10 with every single case I see every day.
Yeah.
You have to have excellent physical, mental fitness. And I love what I do with such a passion. I have boundless energy for it. But to your point, not everyone's like me.
No.
Okay.
Most are not.
And so to perform at my level requires a lot of different elements, not just innate God-given talent, because I was given this artistic gift and technical skill, but also the intellect and the physical ability to execute.
Yeah, you have to know what to do with it.
Then the organizational skills. I mean, there isn't a move I make all day that doesn't have a purpose. Right. And that is something that only Olympians really understand. They can't make one false move when they're on those slopes or they're running that track.
It's true.
That's true. That's how I function. But to your point, the secret in medical circles, medical families is you want to be the first case of the day.
Right. No, it's true.
But not in Macrene's world. In Macrene's world, it doesn't matter whether you're.
So let me ask you a question. I want to talk about that because on a very small scale, as a stylist, I found the biggest challenge for me was delegating to people that I could trust to execute on my vision. Now, with what you do, that's 100x because do you have associates you train to cover for you? Because you do have Europe and Hamptons and New York, hopefully LA.
You're going to love what I'm going to tell you because it's going to just blow your mind open.
That you don't let anyone else do it.
I'm an artist, an intellect, a scientist. The skills I have, the vision I have, the second I see a face, it populates in my mind. I see exactly what needs to be done to restore their natural beauty. Contrast me, who does everything myself, to someone who has a bunch of technicians doing things for them. It's a different model. And I look at it like I'm Michelangelo. I'm Michelangelo. And then there's, I guess, I don't know, you could get Andy Warhol prints made. It's like not that they don't have value.
Sure.
But they're all the same.
Sure.
Whereas mine are masterpieces. And that's why I take care of the world's most famous and cherished faces, who we all know, love, and we need to see them in their natural beauty.
Right.
And those are my patients. And I feel like I'm doing an honor to the world by restoring them. But it is true that I'm one of a kind in that regard.
Right. Yeah. And it's funny because I'm sure so many people said, well, how do you scale that? You're like, I don't. I make product.
So what I realized early on was, wow, I can do this because I have a PhD in genetics. I've actually, with my formulas, which are a combination of peptides, microencapsulated hyaluronic acid, so that replaces Botox and filler, and then DNA repair, which actually restores the skin back to the way it was, plus antioxidants, brighteners, etc., to replace lasers, that I actually am restoring the skin back to the age of roughly 25 before it starts to deteriorate, making myself obsolete.
But by the way, I was going to say, aren't you cannibalizing yourself? Aren't you sabotaging?
No such thing. I mean, think about progress. Progress is a wonderful thing. I'm fearless.
Right.
I'm never afraid because this is wonderful that I can give people freedom. Like you had freedom from needing injections or anything else. I'm doing that for the whole world.
It was so funny. I left your office this summer and I was like going through something and I was like, I just need whatever you think. And I think we just did Botox, but I remember you saying to me, I'm giving you my products. You're not even going to need Botox after this. And I was like, what? I was like, wait, so you're trying to tell me I just have you in a jar now? Is that what you're saying to me?
Yes. And my invention, my patent is.
But that also is how you scale, because ultimately then everybody in the world can have you in a jar, basically.
Yes, because what I do that's different is
on some level.
Yes, no, on all levels, because what I'm doing when I see the patient is I'm not putting my stamp on you. I'm bringing out the natural beauty of Rachel Zoe, period. I'm bringing out the natural beauty of whoever my patient is, and many of them are very famous. And I just see the beauty. It's like when I paint a portrait, I bring out their natural beauty in the subject. It's a gift. So by bringing your skin back to 25, it's your natural beauty. Your natural beauty is your best beauty. You don't have to change that. And yes, there's a little mother's little helper because my lip plumper actually does plump the lips permanently. So you do get a little bit of what I call mother's helper. And that's the great thing. It's like you plus.
Wait, hold on. Not sure I have that. Can I order that, please?
Yes, we'll send that to you. It's fabulous.
I have a lip plumper.
Fabulous. It replaces injectable filler because it's the best microencapsulated hyaluronic acid in the world. Peptides for collagen, ceramides for chaff, and lip therapeutic essential oils and extracts. Is fabulous.
Do you realize, has anyone ever asked to go inside your brain?
Yes, they've asked me to donate it to the Smithsonian. And so what I'm doing is I'm memorializing my brain. So I have a textbook, Alexiadis Cosmetic Dermatologic Surgery. It's the first and only disorder-based textbook in my industry. It takes you down a decision tree to help my colleagues, residents, medical students, and even lay people understand the first, second line, third line treatments for each disorder so they're not led astray. And choosing the wrong device for the wrong thing. Right. And now I just finished my second textbook, which is on photodynamic therapy. That's a specialty of mine that has more to do with skin cancer. And my papers, of course, but most importantly, my patents, because Dr. Macrene Actives is forever. My cream is always cutting edge because it's updated regularly. I have criteria for inclusion of the world's best active ingredients that fulfill the different categories of skin aging that I published almost 20 years ago. It was published in the JAD. It's used in countless clinical FDA trials by other companies to validate their treatments. So what I have done now is working in a genetics component to identify the genes that are responsible for skin aging. That's why Macrene Actives is so good. I'm actually restoring the skin back to the way it was. So it makes me live on forever. It's my legacy. And then there's the mission of the brand, which is to clean up the earth, replacing toxins, replacing procedures, and eliminating plastics.
It's really unbelievable. You are truly extra. I'm so glad that I met you. And I remember when I met you, I felt like I had met you already, but we hadn't. And I just remember giving you this big hug. And I was like, I literally have felt like I've known you and talked to you and just so connected. But I'm so impressed by you. I am.
I don't believe that anything is an accident. Everything that happens is because of the accumulation of not just energy and decisions and values, but it's what brings people together. And you and I instantly were connected because our values align. And I wanted to get back to something you said about fashion. I have studied a lot of philosophy, and Plato talked about the forms, which are basically the entities that make up our existence, and how beauty is the highest form. It's what the gods in the heavens look down on us and smile about. And that's what you were talking about with your work, when you adorn the body with garments that are beautiful, you're enhancing beauty. As an artist, when I restore your natural beauty, and people know true beauty when they see it. Plato also talked about the imitation of beauty, the imitation of art. We know that when we see it.
Yeah.
And that's true whether it's fashion or whether it's what I do. So I believe that coming full circle, yes, I could have been in the lab curing cancer. Indirectly, I have been working on that through photodynamic therapy.
By the way, I'm sort of thinking about that. I'm like, what do we do with this brain? She needs to cure cancer like stat.
Yes. Well, I've been working with photodynamic therapy. So yes, I've been working on that as well. But at the same time, a world without art, without music, without beauty is not a world worth living in. So our missions in our lives, which also align us, is what gives joy to the world. And there's so much value in that.
And confidence, which truthfully, I think without that, we can't really flow through life properly.
Absolutely. I was just saying to my daughter yesterday, confidence is what gives you the belief to achieve your goals, to move forward.
Because I think in all honesty, if you don't actually believe it of yourself, without sounding the cliche of like, you got to believe in yourself. Like you actually, if you don't believe, and that's for me, the most genuine thing coming from you is how strongly you believe in every single step you've taken, why, how, and then how you landed here. It is very interesting, though, that even with all of that, what I'm stuck on, and I think it's just still a little bit naive of me because I hear it every day, but it's still hard for me that when there is someone who has accomplished what you did at such a young age, that even still today, as we see, men just look at you like, no, different. It's like, actually, no, better, And I think like at the end of the day, I think I'm so excited to see you continue doing all of what you do. And I think, there are so many issues now with like, I hear every day someone with skin cancer or like, there are so many things. And as I'm sure the first thing you say to people every day is skin is your largest organ. You cannot, right? That was actually my youngest son reminded me of that. When he was young, mommy, skin is our, it's like, is that
brilliant?
It is.
That's the first episode of my Spotify podcast. Exactly. It's about how the skin is our largest organ. It is our protective organ. It's what filters the toxins, the radiation, the free radicals that come in from the outside world and protect our inner organs from the outside world. So it is terribly, terribly important.
And I don't think anyone thinks that. I think everyone just thinks of it as this like layer of protection that you could beat up all the time. Like you can scrape it, you can burn it, you can, I think it's actually the last organ most people think of until they're like, a teenager with acne or something, right?
Absolutely. And therefore, with my Spotify podcast is really focused. The first episode is really about teaching people about the structure and function of the skin. The second is really about antioxidants and how they work to protect us from free radicals. And the third is about DNA repair. And that's why I know I'm right. We can actually repair the DNA back to the way it was before it sustained these injuries from outside exposures. Right. So it's very logical. And I'm doing it with plant-derived actives, which is why it's so healthy.
I want to ask you about lasers because I know you're a big advocate for lasers. And I know I personally love lasers because I think anything that's non-invasive is always preferred. And I want to talk about what your thought is, like what's your theory on lasers versus because I think we're seeing such unbelievable progress in that. And I feel like it really works. Whereas I don't think it used to. I think now it used to be just, it looked like your face was like bacon after something like that. And I don't think it's that way now.
Brilliant. You know, it's so interesting because I started as a dermatologist, full-fledged, if you will, in 2000 when I graduated residency. And lasers were at their nascency then. So I happened to be at the forefront of the development of a whole new genre and had a hand in every single technology that has been developed since the inception of lasers. So I'm very fortunate, but also I've been very strategic in my involvement in device development. Right. To make sure that I had a hand either in protocol development, device with the engineers development, publication, scientific or clinical studies. And what I can tell you is this: lasers have been around since the 1960s. And what we've done is we've honed devices. And that's why my skin aging classification scale was so important, because prior to that, we just had scales that kind of lumped all of aging together because they used to burn the skin off with resurfacing, the bacon approach, and lump together wrinkles with brown spots, et cetera. We became so specialized in the last 25 years that my skin classification scheme separates laxity from wrinkles, from brown spots, from redness, from telangiectasia, et cetera, so that you can target different categories with different devices, different injectables, and yes, different actives, which is why Macrene Actives is so good. I target all categories. Now, with respect to devices, you're right. There was a period of time where some of these devices were like the emperor's new clothes. Don't you see a difference? I don't know. Do I?
Right.
And that sort of thing. So what I've done is I've introduced objective, quantifiable criteria to the industry. It's one of the things I've been known for. And we've gotten way past that because I demand results on every single patient. And I would say that I was quoted in my household to say the other day, I wish they would apply my standard to every field of medicine. Wouldn't it be nice if psychiatrists only get paid if you get better? I mean, really,
Would be amazing.
Would it be nice? We have
rather than them being enablers half the time, right?
Well, no, but I'm saying Macrene Alexiadis, I demand that those brown spots go away. Right. They don't go away. I'm going to eat this white coat. You know, what I'm saying? I demand results on every single intervention. So I photographically catalog and make sure that the patient sees it, I see it, and everybody else sees it. And by holding myself to that standard, I have pushed the efficacy of my treatments so that I get 100% response rate. And that's one of the things that I've really pushed for from the beginning in my field. So now devices really do get a guaranteed result, in large part due to my work. One of the things I introduced was real-time feedback, meaning that we put temperature sensors, impedance measurements, real-time feedback from the tissue, so you could be assured 100% that you're going to get a result.
It's really unbelievable. I mean, I wish you kind of lived with me. I feel like I'd look so good.
Well, you look gorgeous.
I have a room here in my house for you when you come to LA.
Okay, I'm coming.
You are the best. This has been so much fun. I literally feel educated. I actually feel like I maybe just went to Harvard for an hour.
I wanted to say one last thing. Thank you for the compliment. My daughter said we look like sisters, so I think that you said I'm beautiful.
That's a compliment to me. So I love that. Please say hi to her. I'm so happy to have had you. I learned so much. I know my listeners learned so much. And I mean, Dr. Macrene, I don't even know what to say. I can't wait for you to come here. And I just love what you're doing. You're so impressive. keep shattering all the ceilings.
Thank you. And I will be in LA soon, so hopefully I'll see you. And if your listeners ever interested in a giveaway, I'm happy to support.
Yes. On it. They want it. Trust me, I'm going to answer for them. Here we go. Coming soon. Giveaway. Let's do it.
Thank you so much to Dr. Macrene for coming on the pod today. I truly feel like an hour with her, first of all, is not enough, but I actually think I just went to Harvard Medical School for about an hour. That was one of the most exhilarating experiences. I actually am on a high. I feel like I have this plethora of information in my system now that I just want to keep rerunning and replaying. And I just want to go now have dinner and have Dr. Macrene move into my home. One, so I can wake up looking amazing every day. And two, because she is such a wealth of knowledge. I literally don't think I've ever spoken to anyone like her who just is like this walking book of facts and knowledge and passion and excitement and genuine obsession and love for what she does and to continue bettering herself and the industry and our skin. And what I found the most interesting is that she's continuing to almost outdo herself and almost sabotage what she's built her career on, which is like injectables and all of these different things, that she's now doing topical treatments that would eventually, inevitably, I think, eliminate so much of the invasive things that we do for our skin. So that was really extraordinary. I love this episode so much. Thank you so much for listening to Climbing in Heels. If you haven't already, please subscribe to the show on Apple Podcasts, Spotify, the iHeart app, or wherever you get your podcasts so you don't miss a single episode this season. And be sure to follow me on Instagram at Rachel Zoe and the show at Climbing in Heels Pod for the latest episodes and updates. I will talk to you very soon. Mwah.
M&A, it's the ultimate high-stakes game. Biggest investment, biggest risk, but when you nail it, total game changer for your business. I'm Kisan Patel, host of the M&A Science podcast, where we cut through the noise and dive deep into what really makes M&A work. We're talking real conversations with top practitioners, no fluff, just hard-hitting insights you can actually use. Stay ahead of the curve and learn what it really takes to close deals. Catch M&A Science on your favorite podcast app. Here's to the deal.
Oh man, nothing is worse than a bad cold that knocks you down hard. That's why it's convenient to keep the new Theraflu soft chews right at your fingertips. They have the same multi-symptom relief that you get from Theraflu. Not only are they packed with the power of Theraflu in every single bite, but the easy-to-take chewables are simpler than making soup or tea or whatever. So be prepared and grab some new Theraflu soft chews. Fast, anywhere relief by your side. Use as directed.
Catch the new original Hulu documentary Road Diary. Bruce Springsteen and the E Street Band.
When the world shut down, I made a promise that if we got through this, I'd throw the biggest party I could.
Variety calls Road Diary a soulful celebration. And the New York Post raves, a genius at work.
Can't disappoint the fans. You can't do that.
Road Diary, now streaming on Hulu and Disney+.
Hear that? Pumpkin. That's fall calling. And the pumpkin spice latte is back at Starbucks. From that first sweater to late autumn weather, it's all of fall in just one sip. Order ahead on the Starbucks app.
You hear more and more about identity theft in the news every day. Maybe that's because so much of your personal information is out of your control. Like your insurance provider that has your social security number and your favorite retailer that has your payment details. If they get breached, your information is vulnerable. Fortunately, there's LifeLock. LifeLock monitors hundreds of millions of data points every second for identity threats. If your identity is stolen, a LifeLock US-based restoration specialist will help solve identity theft issues on your behalf, guaranteed, or your money back. Plus, all LifeLock plans are backed by the $1 Million Protection Package, meaning LifeLock will reimburse you up to the limits of your plan if you lose money due to identity theft. You might not be able to control how others handle your personal information, but you can help protect it with LifeLock. Save up to 40% your first year at LifeLock.com/iHeart. That's 40% off your first year at LifeLock.com/iHeart. Terms apply.